Hey, hey, hey. Oh my God. It is so good to be back with you with Ask the Doctors. This is Dr. Jonathan Shepherd here in a brand new year, 2022. I am your host of Ask the Doctors, sponsored by Hope Health Systems. Man, let me know that you're out there, that you're watching. I hope that you are letting people know that Ask the Doctors is back on the air. We took a much needed break, much needed rest, must be able to do what we asked the people to do on our show. And I hope that you had a wonderful season of celebrating. If you celebrated Hanukkah, if you celebrated Christmas, Kwanzaa, and a happy new year. And come on in the room. Let me know that you're here. Like and share and like. And thank you, Chris Define, who's a member of Hope Health Systems. Thank you, Mary McKenzie, for being on here. Thank you, Marie Harris. And I appreciate so many of you all who are letting me know that you're watching on this evening. Please come on. You got to let people know that Ask the Doctors is back live. And I am so excited to be here with you. We have such an important topic today. Let me tell you, 2022 has started in such a way that many of us did not expect. Oh, thank you, Mary Harris, and thank you, Angela Pickney. Yes, thank you. Thank you for that kind message. We missed you all. But yes, 2022 has started in such a way that so many of us did not expect. We were hoping to be able to go through a holiday season, be able to be with our families, be able to celebrate. And a lot of us were disappointed because of the ongoing pandemic. Imagine this, we're entering into 2 years of the COVID-19 SARS-CoV-2 pandemic. And my guest today, I look so forward to hearing what she has to say. But, I think back to what was said at the very beginning, how the pandemic could last for 2, 3 years. And we wanted to throw that person out of the country. We wanted to put that person in front of a firing squad because we said, no way could this pandemic be or go on for 3 years, 2, 3 years. Well, let me tell you, we were mistaken. For we are now entering into the second year. How you doing, Brother Meeks? Oh man, my friend down there in Memphis. Thank you. Who was a constant supporter and encourager. Yeah, it has been a long haul for us. So what we want to do today, we want to take some time to provide some updates. There's a lot of confusion out there. And before I get into that, I want to say that I am proud to be a part of an organization that is helping to provide the testing for our people. For I'm in the state of Maryland, and Maryland right now is being hit hard. It's it is the worst time for our state during this pandemic. And Hope Health Systems, where I serve as the chief medical director, we are providing COVID-19 testing. And so I just ask that if you are in need, like so many people are, hit us up on our website. You can schedule an appointment. We do allow walk-ins, but I tell you, it's best if you schedule an appointment for this testing. We do PCR testing. And so next week, we'll talk a little bit about what we've experienced on that end, because let me tell you, if you waited in a line to receive a COVID-19 test, you're a survivor. You should really tap, even comment in there and let somebody know you are a survivor, because just not to make it into 2022, but to actually stand in line to receive a COVID-19 test. People have stood in line 7, 8, 9 hours. Talk with my barber. He talked about how long he stood in line just the other week, literally. So I want you to know, for those who are in the DMV area, that there are places. Governor Hogan is opening up sites. Well, he's not opening up. He's announcing the sites. The hospitals are opening up the sites. And so we want to make sure that people are going to get tested, for that is very important. All right. Wanted just to mention that during this opening time. Let me go ahead. I have one guest with me today because let me tell you, she by herself is a powerhouse. And I just want to thank you. Oh, yes, yes, yes. Kenya, yeah, you are a survivor. Yes, you are in more ways than one. Thank you, Sarita Watson. Thank you for your encouraging messages. And I really appreciate you all being out there. Before I introduce, come on, like and share and let somebody know that we're on. Ask the Doctors is back on. But I have a powerhouse. She's been with me before. I decided just to have her by herself because when she comes on, there's nothing too much else to say. She provides the information, the insight, the explanation, and the smile to help you to get on through this COVID-19 pandemic. And I speak none other than Dr. Jessica Queen, who I'm going to invite onto the platform right now. How you doing, Jessica?
Doing well. Happy New Year. Good evening, Dr. Shepard.
Happy New Year to you too. It is so good to see you in this new year. And for
Likewise.
those who may not know you or have not seen you previously on this broadcast, let people know who you are and who you represent.
Well, I'm an infectious disease doctor and scientist. I currently work at Johns Hopkins, although I am not here representing them.
Right.
But they are very supportive of my community engagement. So I split my time between doing research in a lab and seeing patients with infections, including COVID-19.
Wonderful, wonderful, wonderful. So um, she is right there on the front lines when it comes to how we battle against this particular virus, this infection. So wonderful. Just give us a quick glimpse. If you want to take the personal angle or the professional angle. I think we last met probably about a quarter ago, at least 3 months ago,
Mm-hmm.
maybe a little bit more. What have you seen these last 3 months? Just has it surprised you? Um, Tell us.
Well, a lot has changed since I was last on the show. I think we had a fairly positive conversation. We were talking about the new recommendations for booster dosing and the fact that the case numbers were lower. So obviously, we're in a very different space now. I can't say that I'm surprised at where we're at. Um, it's certainly, I think, difficult and frustrating for everyone, for me personally and professionally. So I guess just to recap, we're currently experiencing, I think, what we would define as the fourth surge of COVID since its beginning. And we are seeing record numbers of cases. Cases, hospitalizations, deaths are all very high right now. About this time last winter, was sort of the previous peak of cases and hospitalizations in the US. And we are now surpassing those numbers. And, the vast majority of that is due to this new variant, the Omicron variant, which was first detected in the US around the 1st of December and now accounts for an estimated 95% of COVID cases. So it really came in and just took off.
Wow.
So it's really changed the game.
Wow. I'm going to let some of that just settle in. Did you all hear that? We discovered, or I should say identified, that's probably a better word, that the Omicron variant was here December 1st. Many of y'all remember that was a Wednesday. I remember that. And we're now on January 7th. I mean, we're only talking maybe 5 weeks? Maybe a little less than 6 weeks, between 5 to 6 weeks. And now we have moved to that particular variant is over 95% of the infections that we have been able to sequence that is the cause of the COVID-19 infection in so many hospitalized patients or who those who are not even hospitalized. That is amazing. How does that happen? I'm sure somebody's thinking, like, how do we go from December 1st to January 7th, 95%?
Well, first of all, I think we all, at least in the scientific community, knew that there would continue to be new variants. The new variants are really driven by the fact that we don't have enough of the population globally vaccinated. So, this particular variant arose out of sub-Saharan Africa. South Africa and Botswana is where it was first identified. And the population in South Africa at the time was only about 24% vaccinated. Worldwide, we're at about 42% fully vaccinated. That's not boosters. That's just, the initial vaccine series. So the world is a petri dish. You have a large number of people who really don't have any protection against COVID. They get infected, the virus is replicating and spreading. The way variants arise is that as the virus copies itself, it makes little mistakes in the DNA, and we call those mutations. And if those mutations give it a little bit of an advantage, then that can sort of take over. And that population, it's sort of, you've heard of survival of the fittest. The virus that survives the best will start to spread more. So we can see that Omicron is maybe as much as 3 times as infectious or transmissible as Delta, which was even more transmissible than the original virus. So it spreads easier person to person. And we see that even people who've been infected with other strains of COVID in the past, or people who have been vaccinated in the past, they can still, get infected with this variant. And so it spread very quickly.
Wow. Thank you. I hope you all are getting this, because so many people have questions. And so I want to just encourage you right now. If there's any questions that you have, please, this is the platform for you to share, to get your question answered. There are only wise questions. There are no stupid questions. The only stupid question is the one that was not asked. So please do not be afraid. Ask the question, because so many of people are struggling because of what you just said. 3 months ago, we thought we were on our way, and how quick a turnaround this has been. And so please, if there's any questions, drop them in the chat. We'll be glad to answer those questions for you as best as possible. And there's so many myths that are out there right now that people are really holding on to. And you just kind of eliminated some of those myths. So I appreciate you for doing that. When you think about a couple of things that you've said, we see the world as a petri dish. That is quite an analogy that you utilize there, as a petri dish. And you also mentioned how the virus, as it replicates, it makes mistakes. Those are called mutations. And so mutations are occurring so that something can live longer. And so please know that even when you make a mistake, it's not always a bad mistake. All right. So that's a little bit of the other ministry side of me. So
I'm pretty sure.
So, people make mistakes all the time, but sometimes a mistake can work out for the betterment. And this is what happens in viruses, that the mistake happens, and now it actually can stay on stronger. It actually can cling on to what whatever the things of them. And I try not to, I hesitate because I try not to use too many scientific terms when I'm on these type of platforms. So the virus is looking for places to be a host. I say it like that. They're looking for a place to cling on so it can just hold out and give you that infection. And people get disappointed. So I have a question here that's by Sarita Watson, then I'm going to lead the discussion. You mentioned something about South Africa and that particular area as being the place where they first identified that particular variant. So Sarita asked, what percentage of people in South Africa have the shots? I'm not sure if you're aware of that percentage.
Yeah, so I might not have said that clearly, but 24% of the population there is fully vaccinated. I'm not sure how many have gotten one shot, but 24% fully vaccinated. In comparison, the United States, I think we're at about 66%, 62% of the total population is fully vaccinated.
Mm-hmm.
Probably just under 30% are boosted.
Okay. Wow. So you see where we are, and you see where we have a long ways to go.
Mhm.
A long ways to go. I want to emphasize that this is not something that we can just celebrate and say, wow, we have 62% of people. There's even a threshold that some people have even. Is there a threshold that we should be looking for before I move on to my next question?
The higher the better. I think we're aiming for something like 80% of the population.
Mhm.
I do wanna take this opportunity to just, tell people who previously finished their original vaccine series that if you're eligible for a booster, you should get one as soon as possible. We're seeing with the Omicron variant that having a booster protects you much more than just having the original Johnson& and Johnson or the original 2 shots of the Moderna or Pfizer. So right now, if it's been more than 5 months since you finished your original vaccine series with Moderna or Pfizer, you are eligible for a booster. With Johnson& Johnson, I believe if it's been more than 2 months, you
Mhm.
can go ahead and get a booster with Pfizer or Moderna.
Right. Yep. Absolutely. Thank you. That's important information. And that's important to know to go ahead and get those boosters because some people have been scared. Thank you. Because I even had a patient of mine call me yesterday. Yes, I'm in mental health. Yes, I am a psychiatrist. But because I deal with the whole body, people ask me about certain things. So that's why I must be aware, even though this might not be my specialty. And same thing with Dr. Queen. She needs to be aware of just some mental health needs because we are physicians and we try to do our best to make sure that we can take care of everyone. Kenya Robinson has a question, and it really leads into where I was headed. Kenya was asking that she's been vaccinated. She tested positive on Sunday, and she tested negative yesterday, which would have been Thursday.
Mhm.
And which one of these tests should she believe?
That is a great and very relevant question. So first of all, I will say you should believe that your original positive test was a true positive. Particularly if you took it because you were exposed to someone and or you were having symptoms. Um, in terms of the negative test after 4 days, we know that and I'm not sure what kind of test she took, if it was a home self-test or a PCR at a lab, so the
Mhm,
test characteristics can be different.
mhm.
But there's a certain window of time when your test is most likely to be positive, and that's when you're shedding a lot of virus, in your nose, where you get swabbed. And so if you had just recently been exposed or you, were just early in your symptoms, that's when you're most likely to have a positive test. Eventually, the test will revert to negative when your body starts to control the virus and there's less of it present in your airways. It looks like she said she got a PCR
So,
test.
mhm.
So that's even more sensitive than an antigen test because it basically measures the number of copies of the virus. So if your test was positive on Sunday, you had a case of COVID. And if your follow-up test was negative, that's great. It means that your body effectively cleared the infection. And it's probably because you were vaccinated. So I'm glad that you had that result.
Wow. Listen to that clarity of response. Thank you. So does that mean now can she go out? What can
Um,
she do now that it's negative? Maybe that's a better question. What can she safely do? What would you advise her?
right. So this is probably a good time to talk about the CDC's most
Mhm,
updated
mhm,
guidelines about isolation and quarantine. So isolation is when you've been diagnosed with COVID, how long do you have to isolate yourself to protect others? So they've recently come out about a week ago and said that they're shortening that time period. In most cases, there is some fine print that you start the clock on the day that you had a positive test or the day that your symptoms started. Some people have symptoms and then delay getting a test, and that you should isolate for at least 5 days. So if your test was on Sunday, that's day 0. So Monday's day 1, et cetera, et cetera. Um, They say that at the end of the 5 days, if you haven't had a fever in at least 24 hours and your other symptoms are improving, then you no longer have to isolate at home, but you should continue to wear a mask around others for 5 more days. So you're still on a little bit more higher alert for 10 days. Now, on a state by state, city by city basis, there are some extra points about that rule in terms of follow up testing. So if you have follow up testing that's negative, you can potentially shorten that period. But I think, that's getting a little bit lost in the details. So if it's been 5 days since you got sick, in particular with a negative follow-up PCR, you probably no longer need to isolate in your home, but keep wearing a mask around others.
All right, great. That's great advice. Thank you. And we definitely going to deal a little bit about the CDC guidelines because there's been a lot of controversy, some confusion about that. So let me look at this question that Mr. Meeks put in there, and I want him to even provide a little bit more information because I want to make sure I'm understanding what you're saying. He says that he's been vaccinated and he received his booster on September the 13th, 2021. Now, I was not aware that the boosters were available at that time, so maybe you can help shed some light on that. He said, should I be concerned about receiving another booster soon? I thought the boosters came out like in late October, because I know I got mine at the beginning of November.
Yeah, I think for the general population, that recommendation came out in late October. I don't know the details of Mr. Meek's medical history. There were some special populations that were able to get extra shots early.
Gotcha.
So I think that's a great question. Everyone's wondering, and I don't have an answer for you yet. I think that COVID vaccination is something that will require regular boosters, which a number of other vaccines do. For instance, flu shots are different formulations every year because the flu mutates very quickly and we're trying to cover different variants. It's the same principle. The question is, how often is our government going to recommend boosters? Things are very much still in flux. So I think they're watching the data and trying to make the best decisions. When they first came out with the recommendation to give boosters to everyone, I was a little bit skeptical because I thought the data was strongest for the elderly and people with compromised immune systems. And I dragged my feet a little bit, and I eventually got my booster just before Thanksgiving.
Mm-hmm.
I'm really glad I did, because, as we discussed, by the time you knew Omicron existed and that there were lots of breakthrough cases in vaccinated people, it was everywhere, right?
Yeah.
Like my experience was I kind of looked up the week of Christmas and I had friends and family and colleagues telling me, oh my gosh, I just got COVID.
Yep.
So I think we'll see what the data shows, but if the CDC recommends another booster after another 5 months, I'll be in line because I think we're going to continue to see waves of variants. Hopefully nothing more severe than what we've previously experienced, but.
Gotcha. All right. No, thank you, Mr. Meeks. I'm not trying to get you to disclose anything that you do not feel comfortable in disclosing. I just want to make sure that in these questions that people were clear as to when the boosters were made available to the public. That's why Dr. Queen is on here to provide that guidance. So thank you, sir. And anything that you share, and we know that anything that anybody shares on here, we appreciate your ability and the courage that it takes to do that. And we also, as Dr. Queen has also stated, we want to make sure that we're just providing assistance and guidance. We want to also make sure that you always go to your own primary care doctor, your own physician, to get the recommendations that are specific for you. This platform has been greatly helpful for so many people because there's just so many people who are just confused. And so thank you for that. Stephen Jones is here. I appreciate you, sir. for being on. Let's go a little bit further because you're right. I got my booster in the beginning of November. I really was struggling. I'll be honest with you, but the first Saturday in November, I got it. I stood in line. I was a walk-in to one of the pharmacies, and I said, let me just go ahead and get the booster. I've been hearing now that in Israel, that they're looking at a fourth shot right now.
Mhm.
Um, isn't that something? Like we've had three, you know, they're actually looking at an additional four, and the studies are continuing to be publicated and published. Published is the right word as to how that is going to pan out for us. I know Israel has been one of the leading countries when it comes to how to manage the COVID-19 infection. I don't know if you want to comment on any of that before we shift.
No, just to reiterate what you said, which is that Israel is a small country that has been very proactive about vaccinating their population and closely following the data. Um, and we have often incorporated their data into our decision making in terms of what the CDC recommends. Um, so if they end up doing another round of boosters, I would not be surprised if the FDA and the CDC considered that for our population.
Gotcha. Let's talk a little bit about the area where we are in Baltimore,
Yeah.
Maryland. And I mentioned that in my introduction about Baltimore is being hit hard. The state of Maryland has been hit so hard. Why
Mhm.
don't you just talk a little bit about what we've seen here in Maryland and what our Governor Larry Hogan, has stated? I'm mentioning that because what's happening here may very well happen in your area and region. And so if it's not happening there now, you need to take this information that you heard today and say, look, I just heard this on Ask the Doctors. We need to be prepared. So why don't you go ahead and share some of that, Dr. Quinn?
Yeah, so I pulled up the COVID numbers from the Maryland Department of Health dashboard, which is on their website for anybody who wants to check it. They have the state numbers and then every county. So altogether, since the start of the pandemic, we have had over 800,000 confirmed cases of COVID in Maryland,
Mm.
and almost 12,000 deaths.
Wow.
And the number that really shocked me was the percent test positivity. So I
Mm.
know we've talked about this on the show in the past. I'll just remind people the percent test positivity is, out of all the tests people take, what percent are positive. And in the past, we've talked about 5% as kind of
Mhm.
the threshold where if you're above 5%, that's a pretty significant community spread. Maryland's percent positivity this week, 28.3%.
Wow.
And I want to point out that that largely reflects people who go to urgent cares or hospitals and get tests. And
Mm.
a lot of people who were able to access them have been taking the home self tests. So we're not even capturing all of those cases. Um,
Mm.
so we're above the national average. I will say across the country, our percent positivity is 27%,
Mm.
which to me is just astronomical.
Wow.
That's, more than, 4 people walk in to get tested and one of them is positive. That's a lot.
It's a lot of people.
Mhm.
It's a lot of people. So I hope that. So let's help take this data and help people understand that.
Yeah,
So when we have data, we need to break it down. So
right.
when we're looking at this, is almost so you thought we're approaching 30% of the people. Um, that's more than 1 in 4 people. It's getting closer to 1 in 3 persons who gets tested for COVID is going to be positive. Is that correct?
That's correct.
So that means that people who are responsible for people in this state of Maryland, you need to be aware that the positivity rate is on the rise. It's not decreasing, is it?
Oh, no, it's rising.
It's
Mhm.
rising. Okay. So I'm going step by step for a reason, because there are some people who have said it doesn't matter how many people get together for a gathering. It doesn't matter whether or not we open up the doors of our job. It doesn't matter if we open up the doors to our church. It doesn't matter if we open the doors to our business. You know, Just people just come on in, I want you to be aware that the people who come in, 1 out of 3 persons who get tested most likely is COVID positive.
Mm-hmm.
You have to think about that. Okay, go ahead.
Yeah.
Say more.
To put that in perspective,
Mhm.
last January 2021, Maryland was 9% test positivity.
Wow.
So we're more than 3 times that.
Wow.
I think that we're in a period where people are very tired of their lives being disrupted, being isolated. I get it. It's difficult. And, you know, as more of our population is vaccinated, more of the COVID cases are milder, don't require hospitalization, et cetera, which is great. But I don't think we're really at the point where you can just sort of shrug and say, oh, I have a cold. It's like having a cold. One of the reasons is that our hospitals are stretched beyond belief.
Wow.
So there's 2 issues. One is that people who work at the hospital are also catching COVID.
Mhm.
You know, my hospital, we the week after Christmas, we, you know, had hundreds of people call out sick because they also had COVID or COVID-like symptoms. So you have fewer people fewer doctors, fewer nurses. And then we have so many people admitted to the hospital with COVID. It is record breaking. It's worse than last winter. The hospital is full. We are out of beds. I was working at my hospital yesterday. My job yesterday was to admit people to the medical floors, particularly people with COVID, and we had more patients than beds. So there's a
Wow.
lot of shuffling, you know, who's safe enough to be discharged? Can we have another team take care of this person? Can we convert more areas of the hospital into the COVID bio modes? And that is happening everywhere across the country. So it's a problem for people who have COVID because they can't get admitted to the hospital or they can't get into the level of care they might need. So you see these news stories, you know, my dad has COVID, he needs ECMO to survive. We can't find a hospital with ECMO that can take him. And then everybody who has all their usual health problems, you have a heart attack, you have a stroke, there's no bed for you in the hospital either. So, you know, we're having almost 1 million COVID cases a day. So even if a very small percent of those people need to go to the hospital, in particular, a lot of those people are unvaccinated who need to go to the hospital. We're out of room. The inn is full. You know, it's a crisis.
Wow. I hope you all are hearing this and taking it in just like I am. This is crisis mode. Not what you want to hear at the beginning of a new year, not what you want to hear at the beginning of 2022, but it's where we're at. And I emphasize this not to discourage you, but I emphasize it to actually encourage you so that we can make it through this crisis. We had someone type in because I asked, about surviving the COVID-19 test line. Well, we want you to be able to survive the 4th surge. We want you to be able to survive the Omicron surge because this is crisis mode. And let me tell you, Dr. Shepard, I'm listening. I love it. It hasn't hit me yet. As I was just talking with Dr. Queen, if you look at the patterns, it starts in the Northeast first, where there's more congestion, crowded, but then it starts to move towards the South and Midwest. So let me tell you, just because it hasn't hit your area just yet, you need to be aware that it is coming, and you need to be boosted, vaccinated. Let's start there. Be vaccinated, and then be boosted. Okay, and it will help you in fighting through this pandemic. I have some questions here, and I want to get to them. But thank you, Dr. Quinn. You've been doing an excellent job. This has just been wonderful, wonderful, wonderful. I just want to set the room here. Thank you so much for those who have been responding. We've had a consistent number of people who are on here, so I know that people are engaged. Here's a couple questions from Angela Pinkney. She says, how can you differentiate between the Omicron variant from the flu? That's the first question. We'll start there.
So you can't really without testing. So, COVID symptoms have always overlapped quite a bit with flu symptoms. Fever, cough, congestion, sometimes upset stomach, body aches, chills. A trend we've been noticing with Omicron is that there seems to be a little bit more sort of cold symptoms, upper respiratory, stuffy, runny nose, sore throat. There is some evidence emerging that the symptoms tend to be milder with Omicron. I think a lot of that is probably because a lot more of the population is vaccinated. So if you're vaccinated, you're going to have milder symptoms. But there may also be some just differences in the virus. So you could feel like you just have the sniffles. I personally know a number of people who kind of reached out to me and said, "Oh, I think it's just allergies, or I just have a sore throat, or, I haven't had a fever, but I just kind of feel sniffly. Maybe it's a sinus infection." And I pushed them to get tested and they were positive.
Wow.
So I don't think you can rely on sort of your own feeling about whether it's a cold, a flu, allergies, or COVID. There's so much spread in the community right now. If you have any symptoms that are a hint, you should just get tested.
Gotcha. Is there a frequency in which people should get tested?
So I think it depends. Certainly, if you have any concerning symptoms, go get tested. If you know that you had an exposure, the CDC has some recommendations. They used to say if you were vaccinated, but you had an exposure, you don't have to quarantine at home, but you should get a test about 5 days later. They're now saying if you're boosted, you don't have to quarantine at home, but still get a test after 5 days. If you're vaccinated, it's the same rule as for the unvaccinated. You should quarantine and get a test. So an exposure would be you find out that someone you were around had COVID. You were in their presence within close distance, less than 6 feet, for a total of 15 minutes over the course of a day. Even if you were wearing masks, that still counts as a close contact exposure. So symptoms or exposure, you should test. I think if you have been at large gatherings, been unmasked around a lot of people, etc., might be a good idea to get a test a few days later just to be certain. I think if you're unvaccinated and you have access to testing, you might want to do it a little more frequently. But it's a case-by-case basis, but certainly symptoms or exposure.
Absolutely. And I don't think it's anything wrong for you to ask people to get tested before coming into a gathering. I hosted my family here, and before I even asked, they went and got tested before they came into my home. I didn't ask them. That was not a requirement. They just took it upon themselves. I'm mentioning that because we have to be cognizant. We should be responsible. This is part of where we are right now. And so there's nothing wrong with that. I want to encourage people to do that. That's why I'm mentioning that. I want to encourage you before you go into someone's home for a length of stay or whatever it might be, a conference. You want to be tested so that you have some assurity that whether or not you're positive or negative. All right, I feel myself going down the road on that one, but I'm gonna pull back just a little bit, and we'll come back to that lane just before we conclude. All right, there's a couple other very good questions here. Angela was also asking question number 2: does the Omicron variant cause death like the Delta variant?
So we have very limited data from South Africa and then a little bit of data out of Canada. that the rate of hospitalization and the rate of death is lower with Omicron than Delta.
Mhm.
Now, I would just say, typically when we see a difference like that and we're doing a really rigorous study, we look for things that can explain it, what we call confounding variables. So, as I
Mhm.
mentioned earlier, more people are vaccinated now than there were 6 to 12 months ago. So, that might be part of it. So, I would say, um, certainly your risk of death um, is much lower if you're boosted or if you're vaccinated. Your risk of death from COVID is quite low. If you're unvaccinated, it's hard for me to say if Omicron versus Delta has a higher risk of death. But as an unvaccinated person, you're the person most at risk.
Mhm.
Other people who are at higher risk of death, people with compromised immune systems, even if they're fully vaccinated, their immune system doesn't always produce the right kind of protection in response to the vaccine. So all of these cases are putting that population at risk. I
Okay.
also want to just make a
Mhm.
special note for anyone who is pregnant. It's
Mm.
very, very important for you to get vaccinated.
Wow.
That's the one sort of adult portion of the population that is not highly vaccinated, and pregnant women are at higher risk of severe illness from COVID, and they're at risk of harm to their infants, early labor. Um, it is not a good thing to have a pregnant woman with COVID in the ICU on a ventilator, and we're seeing quite a bit of that.
Wow.
Um, so I do want to just encourage anyone in that situation to please talk to your doctor about getting vaccinated.
Wow. Wow. Thank you. That's such important information because people don't want to touch pregnancy, but we need to touch it. And I say touch it, the topic of pregnancy.
Mhm.
Um, I can just remember back in my training in medical school of what happens when a female becomes pregnant and how even her lung capacity is reduced because of the pushing up of the child in the uterus. Why does that make a difference, Dr. Shepard? Because COVID-19 attacks the lungs. And so when you have less capacity, you have less area for you to be able to breathe. And when you are dealing with a virus that attacks your respiratory system, that really does harm you. And so there's just so many different things. As you were just saying, my mind began to go back as to what happens when a female is pregnant. Thank you for saying that. So if you know anyone out there, if you're pregnant yourself and you haven't gotten vaccinated, please do that. You're saving your child's life and your life by doing such. Very, very good. The next question is one that Chris Define asks. He asks, what are the experts saying about the massive Omicron surge possibly resulting in herd immunity? I know I haven't heard a lot about this. I really haven't heard too much about herd immunity lately, honestly. Um, just interested if you have any insight on that.
I don't know that I've heard any qualified people comment on that publicly. I can just speculate a little bit. So, um, you know, uh, as we continue to have surges, more and more people will have gotten COVID. Um, Ideally, we reach herd immunity mostly with vaccination because then you're not risking death and chronic illness and disability from actually getting the infection. Um, so, yeah, I mean, I think logically, if we have millions and millions of new cases, you're going to have a higher percent of the population who has some level of immunity. I will say that, as Omicron is showing us, there are going to be variants that can learn to escape our immune responses
Mhm.
and our vaccine protection. So this might be a little bit of a moving target. And then for people who have been infected but never vaccinated, their immune response is actually not as robust as people who've
Right.
been vaccinated. Um, So there's a possibility that, you could have had COVID in the first wave, COVID in the fourth wave, never got vaccinated. There could be a variant that comes through in the fifth wave and you still have severe illness. So I still think the main focus is getting everyone vaccinated. Um, I think eventually we'll get to a point where enough of the population is vaccinated that when we have these big surges come through, we won't have as many people who need hospitalization, but we're not there yet. We're sort of not at that phase where COVID is just part of the usual cold and flu season, obviously. We're still at a point where it's causing the healthcare system to grind to a halt. So it's a great
Absolutely.
question, but I don't think we know the answer yet.
And honestly, I just want to stay there and repeat what you said. The natural infection response is lower than the person's response who's been vaccinated when COVID-19 enters the body. Is that correct?
That's correct. We have some information if you look at kind of the details of the immune response that you have. So, what kind of antibodies you produce, how many different things can they target, how well do they, respond. Vaccines have a benefit over natural infection, and then we have some data looking at, patients. If you have had COVID before and you get it again, versus if you've been vaccinated and then you get COVID, the people who were vaccinated did a lot better than those who had just recovered from a natural infection.
Gotcha. All right. This is wonderful. We're going to start wrapping it up. This has been so informative. We want to make sure that any questions that you have, this is a great time to ask them now. We want to make sure that you get your doubts out as best as possible. We want you to share this with your family, share this broadcast so that they can be informed. One of the things that I understand is that people trust people who they know. It's hard for people to trust people who they don't know. And so when they hear you providing information, they know that you are someone who they can trust, then they're more likely to go forward in doing those recommendations that have been given to them. And that just makes sense. Thank you again, Mr. Meeks, talking about how he has some at-home tests and he tests himself, I believe, weekly before he goes around certain areas, certain members of his family, work, and church. That is so brave and so admirable of you in doing that. So I commend you on doing that, sir. So many of us need to do that more and just be mindful of what is happening around us. I know some people are just scared. So that's why I'm going to, as we're wrapping up here, you're scared to know your status, so to speak. I don't want to know if I'm positive. I don't want to know if I'm positive, Dr. Shepherd. Oh my God, no, I can't. Let me tell you, not knowing is scary. Honestly, that's more scarier than going to get the test because you want to make sure that you're made aware of what is happening within your body. I also want to put a plug here. This is not the time to forego your screenings with your primary care doctors. Yes, this is still time to get your screenings for whatever age range that you're within. Don't forego the flu vaccine, the pneumonia vaccine, the shingles vaccine. When I went to get the booster, Dr. Queen, they were offering like 5 different vaccines that day. And that was just when the children between I believe that was let me see, in November, that would have been what, the adolescents, I believe. No. Actually, I think the ones between 5 and 12, I think that
5 and
came up.
12. Mm-hmm.
Yeah. So while I was there, I was getting my booster. There's little children in line to get the a shot, and there are people that get the pneumonia shot. There are people who get the shingles, and then there are people who get the flu vaccine. That was something to see, where this particular pharmacy was literally giving out 5 different vaccinations, and people were lined up, eager to go, and that was so encouraging to see. Um, All right. Dr. Hayes, thank you so much, sir. We're glad to see you in the new year. Glad that you made it on over. Um, all right. And he likes to ask these little pointed questions, so I love it. He asks, is the country, I guess he's talking about the United States of America, in a search and rescue mode or a search and recovery mode, with the virus being the focus. Now, thank you, sir. Now, we don't run the United States of America now.
I was going to say, one tweet President Biden and see if you get a response to that one.
Did you hear, Dr. Queen, that they're talking about mailing out testing kits, at home testing kits to all Americans within the
As
next
they should.
month?
I mean, I think it's great that we have really good tests available over the counter, but they're, $25 for a testing kit if you can find them, which you can't at any of the pharmacies right now. So I think that is a great idea, and I hope they follow through with it.
Wow. All right. Well, you heard it here. So hopefully that does happen. I do know where some people have had to pay hundreds of dollars for a kit. And that's where we have to be careful, where we don't allow the marketing and the capitalism, that's the better word, part of our society take over. Unfortunately, we've had shows about this where in our country we benefit from people being sick. That in my opinion, that's not the way in which we are to handle those who are ill. But that's what happens when you live in a capitalistic society. Pharmaceutical companies, they are making big money. Let me tell you, Pfizer, Moderna, Johnson & Johnson, I don't know about, but those their profits are not as high. I mean, they're making their money. But I tell you, they're benefiting from this vaccine. You know what? One of the things I have found, and again, this is a question that I have, and then we're going to let it go for this evening. That Pfizer has been approved for children 5 to 12. Moderna still hasn't been approved. And now I got Moderna as an adult, and I got that booster also through Moderna. And, it does leave my head scratching just a little bit as to why their particular formula has not been approved yet for children 5 to 12. I don't know if you have any insight on that. What's the holdup there?
I'm not up to date on the latest data. Last I heard, they were completing their analysis from their trials in children.
Mm-hmm.
I imagine that once they have proven that it's effective and safe in that age group, they'll go to the FDA for authorization, but I'm not sure what the status is.
Gotcha. Yeah, yeah. And again, we literally, as we're saying right now, when we don't know something, we let you know because things are changing literally week by week, and it really has increased many of my colleagues' appetite for learning. But let me tell you, you have your appetite increase so much that you start to burn out. So please, when you see a provider, a frontline responder, please pray for them. Please let them know that you are encouraging them, supporting them, because we do need it, because it has really taken its toll on us, from the mental health world all the way to the infectious disease world. And this has been a wonderful, excellent conversation. Man, been good. It looks like, let's see what Dr. Hayes is saying now. All right. All right. Yeah, thank you, sir. I appreciate your comments as always. So if you're in need of COVID-19 testing, all right, send them a thank you letter. All right. Thank you. Thank you. That's right. Appreciate it. If you're in need of COVID-19 testing, Hope Health Systems, where I serve as Chief Medical Director, we do have a primary care clinic that's called Agape, and we do provide COVID-19 PCR testing. And I look forward to next week where we can describe a little bit about what we are doing and what we've seen. I've seen it on my end, just the number of people come through. And we had to change on a dime because we don't want to mix people who might be infected with other people coming in for their mental health issues. And so it was just such a, I mean, you talking about a demand for the testing. I know that schools, that's what I was just going to mention. As I was looking during our broadcast now, that some of the schools may not be going back in person next week, Dr. Queen. Wow. That they're looking to going back to virtual learning.
Mm-hmm.
A lot of parents are upset about that because we know that virtual learning for the majority of the students was not effective. For some, it was, yes, and thank God if it was for your child and family, but for many of them, it was not effective. And so it's just a really a literally day by day, week by week, month by month status. And so we hope today brought you some information that you can utilize. Dr. Queen, are there any parting words that you may want to tell our listening audience today? And then we're going to wrap it up.
My parting words, get vaccinated, get boosted, and be prayerful. These are trying times.
Absolutely. Thank you. Thank you. Thank you so much. Hope Health Systems, the along the line, our banner along the bottom of our screen, excuse me there, the banner is scrolling. You can go right there and you can sign up for mental health services. You can get your appointment for COVID-19 testing. All of that is right there on our website. This is a wonderful start to the 2022 year. I'm looking forward to more interaction with you all, more engagement, have some exciting things on the horizon for this particular broadcast. Thank you so much. Please like and share so that we can go back and let the people know that Ask the Doctors is back on the air for 2022. And thank you for all those who are watching the replays. As we know, we get triple the amount of replays than we do on live. So thank you. I appreciate all of you all out there. Please be safe, and we'll see you on next week, Friday. Take care.